of going back to thyroid, we're often seeing issues with that. Vitamin D, B12, heart disease, diabetes, obesity, high blood pressures. Sometimes if we can fix the nutritional health very quickly, we see the blood pressure just immediately normalize. Osteoporosis, cancers, and again, at the base level with regard to cancers, if we can just improve the situation, if we can oxygenate it. I've seen some of you where we've had a look at your nails and there's a little less oxygenation, that your cardiac values aren't flowing the way they should be, and this is part of it. This is part of improving oxygenation at a cellular level. And again, some of these technologies are amazing at it. I mean, even the water can improve this story at that level, and it's incredibly important. So symptoms: feeling tired, brittle dry hair, ridged or spoon-shaped nails, and that's actually a real corker. If you've got your nails are doing that, then we need to look at the cellular health issues. Dental problems, changes in bowel habits, of course, mood and mental health issues, because you're not absorbing the goodies. You're not getting the nutrients, the dense nutrients that you need to exist. And then easy bruising, slow healing, and a slow immune response. B vitamin deficiency. This is a beauty. A lot of us self-prescribe and take vitamin B. It comes in a couple of different forms. This is one of the least absorbed out of everything I see. Often it's one of the first nutrients or one of the first vitamins I actually take away from people because it's overwhelming their system and it's actually not helping the situation. So vitamin B can be a little intense for your body, particularly if you're not absorbing. So don't just go and take any kind of vitamin B. You need to see what's in it. You need to see how they've, how they've put it together. You need to see the variances of types of vitamin Bs that you can have access to. And most importantly, we need to make sure that it's in fact the correct one for you. You're absorbing it, you're doing something meaningful with it, as opposed to just excreting it. And sometimes with B vitamins, people can be very sensitive, so they can give them headaches, hives, they can get stomach upsets, and all kinds of things, and often it's from a vitamin B ingestion. So symptoms: fatigue, depression, insomnia, confusion, hypoglycemia, cramping in the arms and legs, which can also be a magnesium situation, learning difficulties, muscle weakness, recurrent colds, and diarrhea or constipation. I will often see the recurrent colds thing in small children who are often B deficient, except I wouldn't necessarily give them a supplement. What I'd probably prefer to do is have a good hard look at their absorption, have a good hard look at what's going on in their digestion, and then trying to get them to absorb better so that when they eat, they're actually just absorbing the goodies from that. Thyroid insufficiency, boy, how much do we see that? And one of the things about this is we're not just seeing it in women anymore. I mean, this is your central control system. We're seeing it in men as well. One of the things about thyroids is that I treat a lot of women who have been told that their levels are correct, they're fine, and in fact, they're actually not. They're so far from not well. No wonder they couldn't lose weight. No wonder they were constipated. No wonder they have poor memory and concentration. And the list goes on. So we really need to address that, particularly you women, but I am seeing it a lot more in men. Often the structure of men in coming with a thyroid insufficiency, though, is often not the thyroid. It's really the adrenals or the liver not behaving, and it's affecting the thyroid. So the treatment protocols tend to be a little bit differently. But again, high susceptibility to, let's go up to usual deficiencies, vertigo, hearing loss. Can you believe that? Hearing loss. You can experience hearing loss from having a thyroid deficiency. Neuropathies, Meniere's disease, poor night vision, carpal tunnel syndrome, multiple miscarriages, poor digestion, adrenal issues. If we get a fertile lady's act together with her thyroid, often they just get pregnant immediately. I mean, it can be that simple. Symptoms: high susceptibility to infections, water retention, muscular weakness. Adult acne is a biggie. We're seeing that a lot more, and we're seeing that in ladies that are sort of 40s and 50s, which is rather interesting. Slow wound healing, hair loss is a biggie. Coarse or dry hair, the sluggish speech. Again, somebody will come into the office and they're just not articulating. They're not speaking that well. And sometimes, again, the first thing I want to look at is I want to see a thyroid panel test because I want to see what's going on with this. And once we can kind of improve it, invigorate it, fix their diet, fix their absorption issues, they begin to articulate, they don't have the brain fog, their memories are great, etc. Liver, gallbladder. Well, the list goes on for those two things, but basically elevated blood cholesterol, food allergies, all the chemical hypersensitivities, we have to treat the liver, and ergo the gallbladder gets a kick with that as well when we come across those. And I'm coming across more and more chemical hypersensitivities every day. I'm really looking at that with all of the profiling when I look at patients now, because there's often, like more than 50% now, that there's something that could be irritating them on that basis. Acne, fibrocystic breasts, premenstrual syndrome, and then symptoms: belching or passing gas, heartburn, nausea, vomiting, anxiety. So far, is everybody like going, yep, that's me, yep, that's me? Yeah, no, they're all tied in. And again, one of the tricks, or one of the things that is the challenge for me, is to figure out what the primary is, because I don't have to treat everything. What I've got to do is be clever enough to figure out, in conjunction with you and what resonates with you, is to what we're going to treat, one, and then sometimes everything else falls into place. It's magic, but it can be that simple. So symptoms, again, if you find that you're, a lot of nausea, vomiting, the anxiety, the mood swings, and all of itchy ears is a corker. That's quite common for people who have liver deficiencies, is itchy ears. Fatigue and sluggishness, and also burning feet. Some people mistake burning feet neuropathy and that sort of thing. It's actually, if we treat their liver, that actually gets better. Adrenal and melatonin insufficiencies, again, the usual deficiencies. Again, when we're seeing this, sometimes I'm going thyroid, sometimes I'm going adrenal, but usually what happens is I treat the adrenal, and often the thyroid kind of corrects itself. People think the hair loss is the thyroid thing. It could be. They're closely related in terms of their functioning and how you get your symptoms, but often if we fix the adrenal, again, it's that stress story, we start to see improvements. Tendency to inflammation, increased susceptibility to cancers, palpitations, hypoglycemia, and poor resistance to infections. Again, you'll see that come up a lot, the poor resistance to infections. Again, it's usually a singular thing. Once we can kind of correct that, the rest of it comes into play. Symptoms, again, at the bottom, you have excessive fatigue, weakness, confusion, insomnia, craving for sweets. That's a beauty. And coffee. People who have adrenal insufficiencies are looking for sweets. They're looking for coffee. But here's the deal. If you do that enough, and I'm sure some of you have experienced this, you actually find that when you go to get the hit, you go to get the sugar hit, in fact, you crash. So it stops behaving like a hyperstimulant, and in fact, it makes you tired. And that, again, is a great indicator that your adrenals are just overwhelmed. So if it's no longer picking you up and it's actually making you tired, it's likely to be something along these lines. Growth hormone deficiency. The usual deficiencies for these, this is something that typically declines as we get older, but again, with some of these technologies, it's looking like we can pick this one up pretty quickly. But overweight, increased body and abdominal fat, skin thinning and dryness, reduced muscle mass, and low mood depression. So if we can start to change things on a cellular level, we can improve nutrition, we can reduce inflammation, then this is also going to be corrected to some large degree. Symptoms, and again, you see the anxiety or the depression, baldness in men and decrease in sexual function and interest, decreased muscle mass and strength. And what's interesting is, again, we want to be testing DHEA, we want to be testing testosterone and other things to rule out some of these issues. Difficult to concentrate and lack of memory, dry, thin skin, and you usually have elevated triglyceride levels. That's usually a given. And then there's some fatigue or tiredness. Dysglycemia and body comp, usual deficiencies, there's the previous lecture I did, the diabetes, and then excessive appetite or binge or uncontrolled eating. So again, there's a confusion with the blood sugar, and we often then want to look at the pre-diabetic, diabetic potential state. Symptoms, again, kind of adrenal-ish, but we want to look at crave sugar or coffee in the afternoon. And then these things like frequent thirst, frequent urination, headaches, insomnia, shake, all of these things are absolute classic pre or diabetic symptoms. So if you have any of these or a succession of these, this is something you really need to explore. Food allergies, this is the one I spend the most time in. Kind of a little interesting anecdotal sidebar thing. If up until the age of 10, if you have profound symptoms before the age of 10, so for instance, dairy, if you're just a big mucus ball and it's not happening and you don't feel well and you're sneezing, and before the age of 10, it is likely that we're going to call that an allergy. Post 10, we're really more looking at sensitivities. And I don't know how many of you are finding that as you get older, stuff that didn't bother you before is bothering you now. And that's just an accrued, your body, your immune situation is not as robust anymore. These things are catching up with you. They're creating inflammation, and they're creating all manner of other difficulties. So somebody who has a flare-up of rheumatoid arthritis, I'd be looking at this before I touched them with anything else. I'd want to know what they're eating, I'd want to know the effect that it has on them, and I'd want to know whether their system is robust enough to be able to absorb and do something with it. Symptoms, again, well, actually, the gut and systemic inflammation, dyslexia is a beauty. I mean, we treat children, correct their diets or correct their parents, and then it flows down to the children. We start to see an improvement with that. Crohn's disease, colitis, alternating bowel function, and peptic ulcer, weight issues. The symptoms are vast, but the ones I see the most are the ones listed here. So depression, drowsiness, fatigue. Sore throat, I see it all the time, itching, sneezing, sinus pain, hearing loss, and sensitivities. Hearing loss, when that is a reported symptom, I am now looking at thyroid, I am looking at kidney function, and I am well and truly looking at food allergies. Symptoms, again, as you can see, recurring infections in children is an absolute, it's a deal breaker. If you've got children or you've got nephews and nieces and you see them coming up, they've got rashes, their nose is running, get their parents to take them, or you take them if they're your children, to somebody who understands this field. Because if we can correct it at an early age, they're not going to get all the associated, and I'm serious, the associated devastating diseases that we're seeing now. We got to correct this early. Connective tissue and vasculature. Again, the usual deficiencies are classic. We would see lupus, we'd see rheumatoid arthritis, kidney damage, heart disease, digestive tract damage, anemia, and hearing loss. Again, you wouldn't think they were connected, but they certainly are. And symptoms for this are very much a general feeling of being unwell. You can't really quite pinpoint it. You just don't feel good. This can be accompanied by increased fatigue and also a mild fever. So we'd be looking at a few other things with there. The cold and numb fingers or toes, swollen fingers or hands or muscle joint, pain, rash, stiffness. And we have to rule out a bunch of other issues with this. But again, there it is. Joint muscle